Dear students, we will discuss an operative procedure which is done to correct the complication of a surgery. So remember, surgery is done, complication has occurred. To correct that, one more procedure is done. So before discussing that, we'll just go through the MCQs. The quantity of dye injected for ceolography, all of you know in salivary glands done, should not exceed more than A, B, C, D. Put the right answer. Acknowledge and appreciate your answer. Put it in the comment box. You'll get the answer in 24 to 48 hours. The Newman-Seabrook's operation is done in A, B, C, D. Again, put the right answer. I'll appreciate and acknowledge your answer. Put it in the comment box. Before discussing this operative procedure, again I request students, please subscribe my YouTube channel. It is free. Share with your friends and colleagues to update your knowledge about on day-to-day basis to learn surgery with brief lectures about images, X-rays, specimens, instruments, operative procedures, brief complications also on daily basis. Also, we'll have a live session once in 2 weeks where student will present a case. We got faculties other than me and other than me, senior faculties from different colleges will join and have an interactive session for more than 1.5 hours. It will give a clear highlight about how to face a practical exam, what all questions will be asked, and how exactly you will present a case in a clinical discussion. So clear-cut practical examination point. It is very, very useful. Join if you join live session, and also if you join live session, you will get a certificate which will be very, very useful for your future career. So answer the right answer. So what this operative procedure is? See that you can see that left eye here, patient had a scar here. Probably periodictomy is done here, and see that eye is like this. It is stitched here, stitched lateral aspect. So it is for facial nerve palsy, which patient has developed after periodictomy. And common complication of periodictomy is facial nerve palsy, which is real worrisome. Proper dissection is important. So many methods to identify how to identify facial nerve from distal part, proximal part, identify the trunk. All those different methods are there. You can always go through my manual of surgery in the parotid salivary gland chapter. It was detailed discussion about the periodictomy complication, facial nerve palsy, Fraze syndrome, and so on. And common worried part is always facial nerve. And once it happens, we usually take help of the ophthalmologist or plastic surgeon to do what is called as lateral tarsorrhaphy. So the lateral aspect of the eyelids are closed so that exposure of the cornea and conjunctiva will not occur, which will make may cause inflammation, exposure keratitis. It may cause a real visual problem in due course of time. That's why this is the one of the procedure. There are so many other methods are there, dynamic method, static method to correct the facial nerve palsy, assessment of the facial nerve palsy also. There are different guidelines are there. You can always go through my manual of surgery. It was very detailed about facial nerve palsy, but this is called as a lateral tarsorrhaphy of exactly it looks like. So that is the important thing you have to remember. So other complications, facial nerve palsy is Fraze syndrome, seroma formation, bleeding, injury to the greater auricular nerve, so numbness in the ear lobule. All those things are there. You can always technical aspect, different incisions, lazy incision, and different types of periodictomy, superficial, total conservative, radical, suprafacial, functional. There are so many different newer concepts have come. There are different levels of parotid are there, level 1, 2, 3, 4, 5, like lymph node levels in the neck. Now parotid has also got a newer concept, levels will come. Please go through my book this about these levels, periodictomy, concepts, complications, and tarsorrhaphy is the method. If there is a patient, one of the methods, there are so many others, search for reference. So please go through my book, chapter 28, and also how to examine salivary gland, patient, parotid swelling or submental salivary gland. Also, you can go through my clinical methods surgery with a QR code lecture, how to examine it is there in the clinical methods. So, quotation of the day is time is free, but it is priceless. Remember, you don't require to pay somebody. Your time is yours. But it is priceless, remember. It is free but priceless. It's very, very important point as far as time is considered. And students, please have my clinical methods in surgery, which has got where lot of photos, how to examine a patient, but no management concept. And from general examination to
hernia, thyroid, hydrocele, breast lump, vascular disease, venous disease, ulcer, swelling, mass abdomen, differential acute abdomen, rectal examination, urology specialties, and briefly orthopedic, and with the instruments and specimens, but no management. It is very good for book for clinical methods, which each chapter has got a QR code where if you click that, you will get a video of how to examine. Suppose hernia, if you click the QR code, how to examine hernia methodically, which is very, very useful for you to face the practical exam. So examination is very, for clinical methods of surgery, please you purchase it, have it. And my manual of surgery, it's very, very popular book in this country and outside the country. And it covers everything as far as CBS syllabus is concerned, and from general surgery to thyroid, breast, endocrine, ulcer, swelling, peripheral disease, varicose vein, breast lump and mass abdomen, GI in detail, urology, neurosurgery, cardiothoracic, operative surgery, instruments, and briefly anesthesia and adjuvant therapies. Everything is covered with the investigation, treatment aspect, management concept, tables, illustrations, photos, quotations, and each chapter has got an online link which gives a lot of MCQs for your reference to face the NEET exam or theory exam or any competitive exam. Enough MCQs for surgery is considered, it is there. So it is a very, very good book, useful to both UGs, PGs to face any type of exam. So please have my SRB Manual of Surgery. My operative surgery is extensive, voluminous 2-volume book which covers everything technically, step by step, with a lot of illustrations and photos to understand the surgery. My Atlas of Surgery, tissue approximately 100 pages atlas with the video to show how to do a suturing, very basic for you and useful to everybody. So students, also I request again to subscribe my YouTube channel, share with your friends, and press the bell, and learn surgery on day-to-day basis, and also join live session whenever it is there. Students, I hope you understood this lecture very well. Thank you so much.